Of the 300,000 women worldwide who have those implants in their chest remain worried about their health. Medical experts say the devices are prone to rupture and that the non-medical grade silicone inside them could cause inflammation and other problems. We talked recently with California plastic surgeon Dr. Grant Stevens about the problems he's had with PIP implants.
Late in the 1990s, I noticed that an unusually large number of our PIP saline patients were reporting back to me with ruptures and deflations. So by 1998 and 1999, I was becoming increasingly worried. And by 2000, when the government issued the statements stating that they weren't going to be allowed in the States anymore because of unusually high deflation rates, I decided to start a study and actually document whether or not they did deflate at an increasing rate.
So to be clear, the scandal we're talking about now, and the directives from the French government, concerns silicone implants, industrial-grade silicone implants made by PIP. What you were focused on back in the late 1990s was saline implants, correct?
That is correct, but the worrisome thing is the shell, the silastic shell, the bag is the same. So this contaminated silicone that we're now being made aware of is contained in the same silastic bag as the saline implants.
So what is it in your view and from your observations was wrong with the bag or defective with the casing?
Well, it turns out that the silastic shell, or the casing to use your term, deflates at a 3 to 4 times higher rate than the typical silastic shell. This may be for a number of reasons, but one of the reasons certainly appears to be the way in which the silastic is cured. PIP has a very unique method of curing the silicone or silastic, and they do this under heat, whereas the other manufacturers, such as Allergan and Mentor, do it at room temperature. This difference in the curing rate results in a flaw of the shell. It makes it easier to develop a leak or a hole or a rupture, and that's what has increased this problem for these women with the defective industrial strength silicone.
Okay, I want to talk about the situation we have right now that is of concern to so many women in Europe and in South America, this industrial grade silicone. What are the risks associated with this kind of matter, this kind of chemical, if that's even the right word, leaking into your body?
Well, the first thing to point out is there's a big difference between medical grade silicone and the silicone we're worried about. The good news is that most women have medical grade silicone, which is free from contaminants and in fact does not pose a health risk. The silicone here in question, the PIP industrial strength silicone, has many contaminants. We're not sure just how many. There are a number of substances which are left behind when silicone is made, and these substances are usually removed before it's used for medical use. We presume that the industrial strength or industrial grade silicone will still have these minor contaminants. We can't be certain just what all can go wrong. We know there's an increased incidence of inflammation. We're not certain about other health risks, but we certainly have concerns about cancer and other toxic exposures, including to platinum potentially. So what we need to do is get these implants out of the women before they rupture. We know they are going to rupture because the shells are defective. We also know the silicone gel is industrial strength, and it has many contaminants. No one would want these contaminants in their chest.
Very, very frightening. Dr. Grant Stevens, plastic surgeon, talked to us from California.